Alrighty, well, my name's Evan Roberts. I'm a PharmD. I graduated from the University of Missouri, Kansas City. Just a brief overview of this presentation. We're going to go over the statistics of opioid use disorder. We'll follow the treatments for opioid use disorder, and then we'll look at some reasons for non-adherence and a little tips and tricks to help with avoiding that non-adherence and getting patients to use their medications a little bit better. So this is a little bit of background about the opioid use disorder. So in 2017, more than 72,000 Americans died from drug overdoses. The biggest cause of this were synthetic opioid, fentanyl analogs, with nearly 30,000 overdose deaths. From 2002 to 2017, there was a 22-fold increase in the total number of deaths involving the fentanyl and other synthetic opioids. And you can see it really spiked in 2013 there with the synthetic opioids. Very alarming, very concerning. And with that, on October 27, 2017, the opioid crisis was declared a nationwide public health emergency, really taking a hard look at opioid use in America. About treatment options available of the opioid use disorder. There's methadone, buprenorphine, naltrexone, and buprenorphine and naloxone, which is also called Suboxone. It's actually the focus of this study. With these treatment options, we'll move on and start talking about each of these individually. First off, we'll talk about methadone. The way methadone works is by preventing withdrawal symptoms and reducing cravings in people who are addicted to an opioid. So this medication doesn't cause a euphoric feeling once patients become used to its effects. And the medication is specifically tailored to each patient with frequent dosing adjustments. Some of the more common side effects are restlessness, nausea, vomiting, slow breathing, itchy skin, and constipation. And some of those serious side effects, difficulty breathing or shallow breathing, lightheadedness or fainting, chest pain, hallucinations, or confusion. Let your doctor know if you have any of these side effects. The next medication I'll talk about is buprenorphine. It was approved by the FDA to treat opioid use disorder as a medication-assisted treatment, part of a comprehensive treatment plan that also involves counseling and other behavioral therapies. Usually it's used in conjunction with many of the other forms of therapy for helping patients that have an opioid use disorder. Are counseling sessions that can help a patient to understand and just talk through the disorder. It is a sublingual, so you put it underneath your tongue and let it dissolve underneath your tongue. Some of the common side effects include constipation, headache, nausea, vomiting, some dizziness, drowsiness, and fatigue. You could have some dry mouth with this medication. Severe side effects of buprenorphine. It can cause respiratory distress, cause an overdose, adrenal insufficiency, dependence, and also withdrawal. Let your doctor know about any of these severe side effects that you may be having. We'll cover the naltrexones. This medication actually is not an opioid medication. It's not addictive, and it doesn't cause withdrawal symptoms after you stop taking that medication. It actually blocks the euphoric and sedative effects of opioids by blocking the opioid receptors themselves. There actually isn't abuse and diversion potential with naltrexone, so that medication could be advantageous for people who are looking to avoid any type of diversion, any type of abuse with a medication. It's definitely a good option for patients to have and providers to have. Some of the common side effects we have are nausea, headache, dizziness, sleepiness, and decreased appetite. We have that headache there bolded because part of this study that we're conducting has headache as one of the side effects to look out for with the study. So be aware of that while you're taking that medication. And some serious side effects of the medication could be a risk of opioid overdose, severe injection site reactions, and then also intense pain. And that's also bolded there because part of this study, it has to do with muscle pains and things like that with the medications. Keep an eye on that as well. All right, so now we'll move on to talk about Suboxone or buprenorphine and naloxone. This medication is used to treat opioid use disorder in conjunction with other therapies like counseling for the opioid use disorder. A combination medication of buprenorphine and naloxone, and that coincides with that opioid partial agonist and antagonist. So what that means is for people that are out and about, they get some heroin on the street, they take it, then they're not going to get high off of that heroin, going to block those receptors and not allow them to have that effect. There are some common side effects. So you can see the headache and pain, which is bolded there. It's going to coincide with this study in general, osteopathic manipulative treatment, OMT, to treat those headache and pain side effects. And it can also cause some nausea and constipation. And then there's some severe side effects as well. So palpitations, it can cause withdrawal, and then also some insomnia. And we'll move on to some reasons for medication non-adherence. I'll give you some hints and tricks and help with hopefully ways that we can avoid these non-adherence options. So some patients may be afraid of side effects of these medications, may have fear of getting side effects overall in general, or a fear of side effects with similar medications. They could have seen a family member or a friend of theirs have side effects with a certain medication. Cost is a real burden to a patient, and they may not have the funds or the availability to fill some medications if they're expensive. Some patients may not fully understand the need for the medication. There could be some disconnect between the provider and the patient, and this disconnect could cause confusion and something to just be aware of. As you can see with this lady here, she's got a table full of medications just scattered throughout. It could be confusing as to which medication she's already taken, which medication she needs to take. With that, some patients may feel like they're taking too many medications and they don't want to add anything to their medication routine that they already have. So once a patient's condition is considered under control, they may feel like they no longer need to take the medication because they think the problem has resolved. In reality, a lot of the times the medication is what's causing that medical problem to resolve. By them stopping the medication, the problem could return. And then lastly, worry. So some patients may be concerned about becoming dependent on a medication and just decide to stop taking it overall. And that just because they're worried about getting dependent on it. Some of them don't have that dependence factor. So you can look at the naltrexone that we covered. It didn't have that dependence factor because it's not an opioid medication itself. And then there are some ways to help non-adherence. On the bottom left there's a picture of an education booklet. Having that education piece to go along with the medication can help ease the mind of a patient, know what to expect while they're taking the medication, know what they need to be doing with the medication, and then knowing symptoms and potential side effects and when they need to report these side effects. Up above there, the Suboxone, it's the buprenorphine extended release injection. There's options available for patients who don't want to take multiple medications throughout the day, and extended release versions are one way that we can help. There's many apps available. So here's a few of the apps that I've used. The one that I've used primarily is the Mango Health app. One, remind patients to take their medications at the correct time. For patients to look up, report anything that they may have going on with them, keep track of their health and things like that. And here are the resources that we had. I hope you learned a lot. Appreciate your time and watching the video, letting us be here to talk with you.